Good day, Ma'am Jenny Porras. So today I am going to discuss about my topic, which is the Enterobius vermicularis bacteria. So what really is the Enterobius vermicularis bacteria? Enterobius vermicularis bacteria can be acquired through environmental contact with soil or food contaminated with eggs. The ineffective eggs are ingested and the larvae hatch within the small intestine. Now going on to the geographical distribution, according to my research, it is worldwide and in cosmopolitan, in temperate zones with about 30 to 50% of the population infected, and more prevalent in children than adults. It is estimated that 500 million people are infected worldwide. Enterobiasis is most common where people live under crowded conditions such as orphanages, kindergartens, and large families. So it says here that it is common in children and next is the habitat. So where can we find the Enterobius vermicularis? Enterobius vermicularis can find in ileum and cecum. Once a vermicularis eggs are ingested, they take about 1 to 2 months to develop into adult worms, which happens in the small intestine. These do not usually cause any symptoms when confined to the ileocecal area. Next is the morphology. So this is the appearance of the E. vermicularis. In adult males of Enterobius measure up to 2.5 mm long by 0.1 to 0.2 mm wide. Adult females measure 8 to 13 mm long by 0.3 to 0.5 mm wide, while in adult males have a blunt posterior end with a single spicule. Females possesses a long pointed tail. In both sexes, there are cephalic expansions. Now we go to life cycle. Infection occurs via self-inoculation, transferring eggs to the mouth with hands that have scratched the perineal area or through exposure to eggs in the environment. Contaminated surfaces, clothes, and bed linens. Next is following ingestion of ineffective eggs, the larvae hatch in the small intestine, and the adults establish themselves in the colon, usually in the cecum. The time interval from ingestion of ineffective eggs to oviposition by the adult females is about 1 month. At fully maturity, adult females measure 8 to 13 mm and adult males to 2 to 5 mm. The adult lifespan is about 2 months, while ingravid females migrate nocturnally outside the anus and oviposit while crawling on the skin of the perineal area. Next is the larvae contained inside the eggs develop. The eggs become ineffective in 4 to 6 hours under optimal conditions. Next is the pathogenesis and clinical features. Enterobiasis is frequently asymptomatic. The most typical symptom is perineal pruritus, especially at night, which may lead to excoriations and bacterial superinfection. Occasionally, invasion of the female genital tract with vulvaginitis and pelvic or peritoneal granulomas can occur. Other symptoms include teeth grinding, anorexia, insomnia, anorexia, irritability, and abdominal pain, which can mimic appendicitis. Vermicularies larvae are often found within the appendix on appendectomy, but the role of these nematode in appendicitis remains controversial. Very rare instances of eosinophilic colitis associated with Vermicularies larvae have been reported. Next is the immunity. The type 2-oriented immune response elicited against Vermicularies could contribute to a balanced activation of the immune system in examined children. Interestingly, although the atopic children showed a stronger activation, they did not exhibit any symptoms, and moreover, there seemed to be some indication of immunosuppression in those children with a positive history of allergic disease. Next is diagnosis. In diagnosis, use of double stick tape on a tongue depressor. This is pressed against the perineal folds where eggs will stick to the tape. Tape is then stuck onto a microscope slide and examined her eggs. Next, we go to treatment. The medications used for the treatment of pinworm are either mebendazole, parenteral pamoate, or albendazole. Any of these drugs are given in one dose initially, and then another single dose of the same drug 2 weeks later. Parenteral pamoate is available without prescription. Last but not the least is prevention and control. So how can the Enterobius vermicularis be prevented? Strict observance of good hand hygiene is the most effective means of preventing pinworm infection. This includes washing hands with soap and warm water after using the toilet, changing diapers, and before handling food. I think that's all. Thank you, Mom.